Have you ever just looked in the mirror, really looked closely at your own eyes, and thought about what they actually are?
Most people probably just see the color and move on.
Right, exactly. Usually we think of them like, I don't know, organic cameras. We imagine these little lenses taking in light, snapping pictures of the world, and then just sending a data cable back to the brain.
Yeah, it's a very mechanical way of thinking about it.
It is. But what if I told you that your eyes aren't just sending data to your brain? Like they actually are your brain.
That is the big twist, isn't it?
It really is.
Yeah.
And because they are literally a piece of your brain sitting right out in the open, they act as this real-time, high-resolution dashboard for the health of your entire body. So today we're doing a deep dive into a comprehensive medical ophthalmology text to really unpack this.
And our mission here isn't to just, give a dry medical lecture.
No, definitely not.
We want to explore how the eye acts as this incredible early warning system for the rest of the body, how to decode its, frankly, bizarre distress signals, and how modern medicine is fighting back against the biggest threats to human vision.
Okay, let's unpack this. The embryological fact, the origin story of the eye, completely blew my mind.
It's a profound shift in perspective. We are so conditioned to isolate the eye as this independent little optical gadget on the front of our face.
Right, but when a fetus is developing in the womb, the eye doesn't just start on the surface of the face.
Yeah.
It actually develops from a structure called the diencephalon,
Exactly. It literally grows as a bud directly out of the developing brain.
which means the eye is contiguous with the brain itself. It's not a separate attachment.
What's fascinating here is that shared origin dictates the actual anatomy of the eye you see in the mirror today. Because it grows from the brain, the layers of the eye perfectly mirror the protective layers of the brain, the meninges. So when you look at the tough outer white part of your eye, the sclera, and that clear window in the front, the cornea,
Am I just looking at some random connective tissue?
not at all. They are structurally analogous to the dura mater. That's the tough, leathery outermost membrane that covers your brain and spinal cord.
That is wild.
And then you have the middle vascular layer. This includes the choroid, the ciliary body, and the iris, which is the part that gives your eye its color.
And that corresponds to the middle layer of the brain's covering.
Right, it acts just like the pure actinoid in the brain, absolutely packed with blood vessels. And finally, the innermost layer, the retina itself, which actually processes the light.
The retina is literally analogous to the brain's white matter.
Exactly.
I mean, I just find that incredible. When you look deeply into someone's eyes, you are quite literally looking at exposed brain tissue.
You really are.
And because it's exposed brain tissue that's just packed with blood vessels, it makes total sense that it reflects our systemic health. It's our dashboard. If something is going wrong in your blood or, your immune system, the eye is going to show it.
It's often the first place it shows up.
I want to look at how thyroid issues show up here because this was wild to me. Take Graves' disease. It's famous for causing proptosis, that bulging eye appearance.
Right, a very classic clinical sign.
I always thought that was just a strange structural quirk. Like, why does a thyroid problem make your eyes pop out? What is actually pushing the eye out of the head?
Well, it really comes down to biological mistaken identity. Graves' disease is an autoimmune condition. Your body produces antibodies that mistakenly attack the thyroid gland, causing it to overproduce hormones.
Okay, so the immune system is hyperactive.
Exactly. But here's the catch. The extraocular muscles, which are the little muscles behind your eyeball that move it around in its socket, they happen to share similar protein receptors with the thyroid gland.
Oh, wait, so the immune system is hunting the thyroid,
Yeah.
but it gets confused and just starts attacking the eye muscles too.
Precisely. The antibodies target those tissues behind the eye, causing massive inflammation, so the muscles become significantly enlarged.
And there's not a lot of room back there.
No, there isn't. These enlarged muscles sit in the confined, fat-filled, bony cavity of the eye socket. They have absolutely nowhere to go. So they push the eyeball forward.
Hence the bulging appearance.
Right.
I read that the first muscle affected is usually the inferior rectus, the one at the very bottom of the eye. If that gets swollen and inflamed, doesn't it restrict how the eye actually moves?
It does, very much so. That enlarged muscle essentially tethers the eye in place. It physically restricts the eyeball's movement, particularly when the patient tries to look up.
Wow.
That tethering is a major clinical sign for a physician. It proves it's not just a large eye, it's an inflamed, restricted orbit.
It really makes the eye feel like a check engine light for your endocrine system. And it doesn't stop with the thyroid either. When you look at how cardiovascular issues like high blood pressure or metabolic issues like diabetes affect the body, they leave physical fingerprints right on the retina.
Very distinct fingerprints.
The text mentions things called cotton wool spots and flame hemorrhages. Now, cotton wool spots sounds soft and, kind of harmless, but I'm guessing they're not.
Far from it. Those visual markers are critical. A cotton wool spot is actually an area of localized tissue death.
Oh, wow.
Yeah, it represents an infarction, essentially a tiny stroke right there in the nerve fiber layer of the retina because blood flow was completely blocked.
Okay, so not fluffy and harmless.
Right.
And what about the flame hemorrhages?
Those occur when the delicate capillaries in that exact same layer simply burst under high pressure or damage. Because the nerve fibers run horizontally across the surface of the retina, the leaked blood tracks along those fibers.
Ah, so it smears.
Exactly. It smears into a characteristic flame-like shape. So when an ophthalmologist looks into your eye and sees a cotton wool spot or a flame hemorrhage, they aren't just worried about your vision.
They're seeing the whole system.
Right. They are getting a direct visualization of what high blood pressure or high blood sugar is likely doing to the tiny blood vessels in your kidneys, your heart, and the rest of your brain.
So the eye doctor is secretly a whole-body cardiologist.
In a way, yes.
But here's where my mind really struggled to grasp this interconnectedness. If I have an underlying autoimmune disease in my joints, something like rheumatoid arthritis, how on earth does joint inflammation lead to my eye literally melting?
It sounds like science fiction.
It really does.
Yeah.
The text calls it a corneal melt or peripheral ulcerative keratitis. The idea of your eye just dissolving sounds absolutely horrifying.
It is horrifying, but it perfectly highlights the eye's unique microenvironment. Rheumatoid arthritis is a systemic disease. It creates these circulating immune complexes.
What are those exactly?
They are basically large clusters of antibodies and antigens locked together, and they travel freely through your bloodstream. Now look at the limbus, which is the border where the clear cornea meets the white sclera of your eye.
Okay, the edge of the colored part, basically.
Right. That specific ring has a very rich blood supply.
So the blood brings those immune clusters right to the edge of the clear window of the eye.
Exactly. These immune complexes can deposit or get stuck in those peripheral blood vessels right at the limbus.
Yeah.
And this triggers a massive, localized inflammatory response.
Right there at the edge of the cornea.
Yes. This inflammation recruits white blood cells, and those cells release destructive enzymes. These enzymes literally begin to dissolve the stroma.
Wait, explain the stroma for me. What is actually dissolving?
Think of the stroma as the thick, transparent scaffolding that makes up the vast majority of your cornea. It's the structural framework that holds the front of your eye in shape.
So it's the support beams.
Right. When those enzymes attack it, the scaffolding collapses. So corneal melt is an incredibly accurate, if graphic, description of what happens when systemic joint inflammation hijacks the eye's local environment.
Okay, that is terrifying. The body dissolving its own scaffolding because of a rogue antibody cluster? And, speaking of things depositing where they shouldn't, I was looking into Wilson's disease from the text.
Ah, yes, a classic example.
Right. This is that rare inherited disorder where your body can't process copper, so heavy metals build up in your liver and your brain.
Yeah.
But it also leaves these highly specific markers in the eye, a sunflower cataract and a Kaiser-Fleischer ring.
It's remarkable.
How does liver failure paint a green ring on your eyeball?
This is truly one of the most elegant diagnostic clues in medicine. Because the copper can't be cleared by the liver, it just circulates in the blood and deposits in various tissues. In the eye, it deposits in Descemet's membrane.
Which is where exactly?
It's the basement membrane, the deepest foundational layer of the cornea. When copper builds up there, it creates this visible brownish-green ring right around the outer edge of the iris.
And that is the Kaiser-Fleischer ring.
Yes, but the copper can also deposit in the capsule that holds the eye's natural lens.
And that causes the sunflower cataract. But why does it form the shape of a sunflower? I mean, why not just a blob?
That's the fascinating part. The human lens capsule has natural Y-shaped sutures. Think of them as biological seams where the tissue comes together during development.
Okay.
The copper naturally settles into these microscopic seams and then radiates outward along the natural architecture of the lens. This creates a central, star-shaped or petal-like opacity.
Wow.
You are literally diagnosing a systemic metabolic liver disease simply by looking closely at the geometry of the front of the eye.
That is just wow. Okay, so if systemic diseases can hijack the eye's blood supply like that, What happens when the eye's own local hardware starts glitching?
That's a whole different category of signals.
Right. How do we decode the difference between a whole body emergency and just a simple localized eye problem? Let's take the classic red eye. It seems like every time my eye is red, I just assume it's allergies or maybe pink eye, viral conjunctivitis.
Sure, that's the most common assumption.
But the text draws a crucial diagnostic dividing line, checking for something called a ciliary flush.
The ciliary flush is a vital clinical clue. It really separates a superficial annoyance from deep structural danger.
How so?
Well, when you have standard pink eye, the redness is usually diffuse. It's spread out all over the white of the eye. But a ciliary flush is a very specific ring of deep red or violet discoloration right at the limbus again, that junction between the clear cornea and the white sclera.
Why is redness specifically in that ring such a bad sign?
Because the blood vessels in that specific ring share a direct connection with the inside of the eye. If a patient has a red, painful eye with a ciliary flush, it indicates the inflammation isn't just on the surface. It's happening deep inside the eye.
Inside, okay.
It points to conditions like anterior uveitis.
And what exactly is the uvea? I hear that term, but it's hard to visualize.
Think of the uvea like the dark, vascular skin of a grape sitting just underneath the white sclera. It's the middle layer we talked about earlier that contains the iris and choroid.
Ah, okay. The P-arachnoid equivalent.
Exactly. When that internal layer gets inflamed uveitis, it's incredibly painful, and it can seriously threaten your vision. Without looking for that ciliary flush, a doctor might see a watery red eye and misdiagnose a serious internal inflammation as just a mild case of viral pink eye.
Okay, so the location of the redness tells us if the danger is inside or outside. But what if the eye is perfectly white, but the patient is in agony, like extreme pain?
If the patient has severe ocular pain, but the eye is completely quiet and white, the pain is most commonly referred from elsewhere. Often you're looking at a severe migraine or a cluster headache. The eye itself is structurally fine, but the nerve pathways surrounding it are firing wildly.
Speaking of migraines, I have to ask you about this bizarre symptom I came across in the text. It's associated with a pediatric variant of migraine called Alice in Wonderland syndrome.
Oh, yes. That's a fascinating neurological phenomena.
It causes macropsia. The patient literally sees objects as being much larger than they actually are. I couldn't believe this was real. If the physical hardware of the eye is working perfectly fine, how does the brain just decide a coffee mug is the size of a building?
It's wild, isn't it?
Is the visual cortex literally magnifying the image?
It's a fantastic question, and it's a great reminder that seeing is an active cognitive process. It's not just passive light reception. The eye is doing its job perfectly. It's sending the exact right pixels to the back of the brain.
Okay.
But in Alice in Wonderland syndrome, the electrical storm of the migraine disrupts the brain's higher processing centers. The brain's ability to integrate visual input with spatial awareness and body image becomes completely skewed.
So the data's right, but the interpretation is wrong.
Exactly. It erroneously scales the image up, that's macropsia, or scales it down, which is micropsia. The distortion is entirely in the software, not the hardware.
That is wild, the software scaling the image wrong. But let's flip that. What if you're experiencing a symptom that is entirely about the local hardware misbehaving?
Okay, what kind of symptom?
I'm talking about flashing lights. If someone tells me I keep seeing flashing lights out of the corner of my eye, my immediate instinct is to think they're having a hallucination or, a neurological event. But this is actually a mechanical issue, right?
Yes, very often it is.
What is mechanically happening when someone experiences photopsia?
This is one of the most elegant examples of how the retina functions. So the main cavity of your eye, the big open space in the middle, is filled with the vitreous.
The gel.
Right. It's a gel that is 99% water and 1% collagen and hyaluronic acid. It has the consistency of raw egg white.
Okay, gross, but good visual.
As we age, this gel slowly liquefies and shrinks. And eventually the back boundary of this gel starts to peel away from the retina. We call this a posterior vitreous detachment.
And as it peels, it pulls.
Exactly. The vitreous is strongly glued to certain parts of the retina, so as the gel shrinks and moves around, it exerts physical traction. It tugs on the photoreceptors.
It's physically pulling on them.
Yes.
Yeah.
Now here is the key concept. The retina only speaks one language.
Light.
Exactly. It does not have pain receptors. Whether it is stimulated properly by a photon of light entering the pupil or stimulated improperly by being physically yanked by shrinking vitreous gel, it fires the exact same electrical signal to the brain.
The retina only speaks light. So a physical pull gets translated by the brain as a flicker of light.
Precisely. You are literally seeing the physical tug on your retina.
That makes total sense.
Yeah.
But how do we know when a symptom crosses the line from an interesting mechanical quirk like a gel shrinking to an absolute emergency? What are the massive red flags we really need to watch out for?
The two most critical red flags in ophthalmology are sudden loss of vision and pain on eye movement.
Okay, let's break those down. Sudden loss of vision.
A true, painless blackout, like a curtain coming down over your vision, suggests an immediate vascular event. You are likely dealing with a retinal artery occlusion, which is literally a stroke inside the eye.
The blood supply is just gone.
Completely cut off, and in those scenarios, time is tissue. You have a very, very narrow window to restore blood flow before the brain tissue in the retina dies permanently.
Okay, that's terrifying. And what about the second one, pain on movement? You mentioned earlier that a white, painful eye might just be a migraine. Why is pain, specifically when moving the eye, a red flag?
Because that specific symptom pain that spikes sharply when you look left or right is a cardinal feature of optic neuritis. That is an inflammation of the optic nerve itself.
The data cable connecting the eye to the brain.
Exactly. As the eyeball moves, it physically stretches that inflamed nerve, causing a sharp spike in pain. And this is a massive red flag because optic neuritis is very frequently the first presenting symptom of multiple sclerosis.
Oh, wow.
Yeah, a demyelinating disease of the central nervous system. So once again, the eye acts as the early warning system for a disease that will eventually affect the entire body.
Okay, so we've mapped how the eye acts as a whole body dashboard, and we've decoded these local distress signals. Now, I really want to pivot to the biggest threats facing our visual systems today.
The major causes of blindness.
Right. As our global lifespans increase, the landscape of blindness has shifted. We're looking at things like age-related macular degeneration and especially diabetic eye disease.
Diabetic retinopathy is a massive global issue.
And since we've established that the retina is exposed brain tissue, and we know it demands a massive amount of oxygen, what happens when chronic high blood sugar starts starving it?
It sets off a devastating cascade. The pathogenesis of diabetic retinopathy is essentially a story of chronic suffocation.
Suffocation of the tissue.
Yes. Over years, elevated glucose levels severely damage the walls of the tiny capillaries in the retina. Eventually, these vessels become completely occluded or blocked off.
Which leads to ischemia. The retinal tissue is completely starved of oxygen.
Exactly. And because the retina is one of the most metabolically active tissues in the human body, it absolutely cannot tolerate starvation. When those capillaries close, the ischemic tissue panics.
It panics.
It does. In a desperate last-ditch attempt to survive and restore blood flow, the starving retina secretes massive amounts of a chemical distress signal. It's called vascular endothelial growth factor, or VEGF.
Wait, but VEGF stands for vascular endothelial growth factor. It's trying to grow new blood vessels to bypass the blocked ones. Isn't that a good thing? Like the body is trying to heal itself.
It sounds like a perfect biological solution, but the execution is disastrous. These new vessels are grown in a panic. They are not normal, healthy tubes. They are highly abnormal, incredibly fragile, and highly prone to leaking.
Oh, no.
And worse, they don't grow flat along the retina where they belong. They grow outward, directly into that clear, vitreous gel we talked about earlier. Clinicians describe them as growing like a cabbage leaf.
Like a cabbage leaf. So you have these leafy, fragile, chaotic vessels just floating in the gel.
Exactly. And because they are anchored in the gel, they are subjected to traction. As the eye moves, or as that vitreous gel naturally shrinks with age, like we discussed, it pulls on these delicate cabbage leaf vessels.
And they tear.
They tear open and they bleed profusely directly into the center of the eye. This causes a sudden, painless loss of vision as the eye fills with blood.
And it gets even worse from there, right? Because the text mentions that blood triggers inflammation, and inflammation triggers scarring.
Yes, that is the vicious cycle. The bleeding leads to the formation of thick, fibrous scar tissue along those abnormal vessels.
And scars contract over time. So you have these fibrous bands attached to the delicate retina, and as the scars shrink, they act like a winch.
That's a great analogy.
They literally pull the retina right off the back of the inside of the eye. A tractional retinal detachment, which means complete, irreversible blindness.
That is the ultimate tragic endpoint of untreated proliferative diabetic retinopathy. The eye's own desperate survival mechanism, growing new vessels to get oxygen, ends up physically destroying the very tissue it was trying to save.
I have to bring up how we historically treated this, because when I read about it in the source material, it sounded completely barbaric.
It was a very different era of medicine.
Before modern drugs, the primary treatment was panretinal laser photocoagulation. We use lasers to basically burn away massive sections of the patient's peripheral retina. We intentionally destroyed large parts of the eye to save the center.
I know it sounds utterly barbaric to our modern sensibilities, but you have to understand the grim calculus of medicine before targeted pharmaceuticals existed. We had a dying eye, and we had to stop the runaway train.
But why burn the retina?
Because that peripheral tissue was the source of the VEGF. It was the starving tissue screaming for oxygen and causing the disastrous cabbage leaf vessels to grow.
So by killing the tissue, you silence the alarm.
Precisely. By using a laser to essentially ablate or kill a huge portion of the peripheral retina, we drastically reduce the eye's overall oxygen demand. The remaining blood supply was then enough for the center of the retina.
And the panic stops.
Right. The VEGF production stopped, and those fragile, bleeding vessels regressed.
It was a sacrifice. We sacrificed the periphery to save the macula, the very center of vision required for reading, recognizing faces, and driving. But the cost was immense.
Yet the side effects were severe.
Patients suffered from severe nyctalopia night blindness and drastically constricted visual fields. They essentially had tunnel vision. In many places, this treatment routinely cost patients their driving licenses anyway. They were saved from total darkness, but their world was permanently shrunk.
It was a brutal trade-off. But that brings us to the modern era, and the paradigm shift here cannot be overstated. We have finally moved from destructive therapy to targeted molecular intervention, intravitreal anti-VEGF injections.
So instead of burning the eye, we inject it.
Yes. We inject specialized engineered antibodies directly into the vitreous cavity of the eye. These antibodies are designed to hunt down the VEGF molecules floating in the eye, bind to them, and neutralize them before they can cause those abnormal vessels to grow.
And it actually works. It just stops the cabbage leaves.
It doesn't just stop them, it can melt them away.
Really?
The abnormal fragile blood vessels actually regress. For conditions like diabetic macular edema, where swelling in the center of the retina destroys detailed vision, these injections rescue and restore vision in roughly 50% of treated patients.
That is incredible.
2 decades ago, those exact same patients would have almost certainly suffered permanent central blindness. It is nothing short of a modern medical miracle.
Okay, we need to take a breath and recap the incredible journey we just went on with this deep dive.
We covered a lot of ground.
We did. We started with this mind-blowing origin story. The eye isn't a camera. It is a contiguous bud of the developing brain with layers that perfectly mirror the brain's own protective meninges.
And we saw how that shared biology turns the eye into the ultimate physiological dashboard.
Right. We learned how an enlarged, inflamed eye muscle tethers the eyeball in Graves' disease, and how rogue immune complexes can cause a cornea's scaffolding to literally melt in rheumatoid arthritis.
We also explored the underlying mechanics of everyday symptoms, how a shrinking vitreous gel tugs on a retina that only speaks the language of light, producing phantom flashes.
And how the brain's software can misinterpret perfect visual data in a migraine, causing Alice in Wonderland syndrome.
Yes, the software glitch.
And finally, we confronted the terrifying reality of diabetic retinopathy, where a starving retina panics, growing those fragile cabbage leaf vessels that bleed and scar until modern medicine steps in with anti-VEGF antibodies to literally melt those threats away.
It's quite a story.
So what does this all mean for you listening right now? Why should you care about the mechanics of the diencephalon and VEGF?
Well, because it proves that your visual system is not an isolated camera bolted onto your face. It is profoundly, intimately interconnected with every heartbeat, every inflammatory marker, and every single drop of blood sugar in your body.
Exactly. Understanding these mechanisms isn't just cool trivia to sound smart at a dinner party. It is the ultimate motivation for your daily habits. It's the physiological reason why managing your blood pressure actually matters.
It makes it real.
It's why controlling your blood sugar isn't just about satisfying a doctor's chart. It's about actively protecting the microscopic blood vessels in your brain's favorite offshoot. It's why wearing UV-blocking sunglasses is vital, and why you absolutely must get regular eye screenings.
That is so important.
Because as we saw with the silent starvation of retinal ischemia, being asymptomatic does not mean you are healthy. Your retina could be secretly suffocating long before your vision actually blurs.
And that profound interconnectedness leaves us with a critical closing perspective to really consider here. The blood vessels coursing through your retina are the only blood vessels in the entire human body that a physician can look at directly in high resolution without making a single cut into your skin.
Right, in plain sight.
Exactly. When an eye doctor looks through your pupil, they're looking at a living, functioning microvascular network in real time.
It's amazing.
So perhaps we need to completely reframe how we view preventative healthcare. If the eye is quite literally a contiguous extension of our brain and its vascular bed is a perfect, transparent mirror of our systemic health, shouldn't we view a routine trip to the eye doctor not merely as an annoying chore to update a glasses prescription, but as the ultimate non-invasive brain and cardiovascular scan?